first off, I want to thank you guys for taking the time to join us tonight. I really appreciate you having me. I do apologize again for us being late. But by show of hands, just out of curiosity, how many of you have heard about all the problems and the glitches with the website and all that kind of stuff? Anybody heard of that yet? Well, I got some great news for you. I didn't design it, so we should be good for the rest of the evening now that we're set up. So hopefully we won't have any glitches or any more problems. But of course, I do have a few more questions for you, just out of curiosity. How many here think insurance is pretty complicated, pretty complex, hard to understand at times? Anybody have that problem?
Yeah.
All right. This is one of my favorite ones. How many people think it's too expensive for what you get? All right, third and final question for you tonight. Who here likes cartoons? There we go. All right. Unfortunately, the only thing I'm not going to be able to do tonight is the cartoons, but hopefully we can, maybe I can shoot you a copy of that.
And you're okay, you need to use it.
Do I need a mic?
If you would, just for the sake of recording.
Okay. All right, is that better?
Yeah.
Okay. It just won't pick up because of connectivity. All right. So unfortunately, the first thing I got to do tonight is the legal part of it. And the first thing I'm going to cover is the materials presented here tonight are provided for informational purposes only. They do not constitute legal advice or legal opinion, and the information contains summaries of various portions of legislations about healthcare reform and may be subject to change without notice. The information, again, is not to be substituted for professional advice from your own personal attorney, agent, accountant, or anybody else that you use to advise you. The information we have tonight is current, is on the market, and that is of 7/3/2013. Okay, one of the first things I like to start with, please understand we're not here representing any company, whether it's Blue Cross, Blue Choice, Coach, or United Healthcare. I'm not here as an insurance agent. What I'm here as is a teacher. Okay, I want to educate you on the truth about the Affordable Care Act, because one of the biggest problems with this piece of legislation in general is the misconception out there. Everybody from every side has taken and run with it, put their own spin on it, and what that's done is caused mass confusion. And it's unfortunate, but that's where we are. So one of the things that we've done at David Crotts and Associates is we developed a division specifically designed for the Affordable Care Act. Okay, it's a community outreach program to help people enroll, educate them on what their options are, and that's it. That's all we do. So hopefully tonight when you leave, you'll leave with information that empowers you to make the right decision for your situation. One of the things that I will say before we get started, if you already know about it, you've already studied about it, and you really just want to know the options as far as they're available to you, you're welcome to ask Kathy or Aaron to go ahead and explain that to you specifically. But otherwise, we're just going to go over it generally tonight. And if you will hold all questions to the end, I think that would be best because we are recording it. So we'll get started. That's my video I hate you guys to see. So we'll talk about first the individual coverage. Beginning in 2014, the Affordable Care Act includes a mandate for most individuals to have health insurance or potentially pay a penalty for not having coverage. Individuals will be required to maintain minimum essential coverage for themselves, but also their dependents. And we'll cover more about the minimum essential coverage as we go on. However, some individuals may be exempt from the mandate or the penalty, while others may be given financial assistance to help pay for this new mandated coverage. Okay? So let's go over the provisions. What exactly did healthcare reform do? Well, the first thing it did was it's got a provision in it for no pre-existing conditions. Now, whether you realize it or not, before healthcare reform was put into place, individual insurance companies, when you wanted coverage, could tell you whether or not they would cover a specific condition. So let's take high blood pressure, for example. Okay, if you went to get coverage and you had high blood pressure, an insurance company could say, I'm going to cover you, but I'm not going to cover anything that has to do with your high blood pressure. So anything they could trace back to high blood pressure, they wouldn't cover. They wouldn't pay for it. Okay. Now, there are no pre-existing conditions. So regardless of what health conditions you may have had in the past, they have to take you, and they also have to cover those conditions. Which brings to the next provision, which is guaranteed issue. It's guaranteed acceptance. No one can be turned down regardless of their past, present, or future health conditions. Okay? That was the big thing with insurance. The people who needed it the most, the people who were sick or had conditions, they couldn't get it. And the insurance company could say, you know what, we don't want to cover you because you're sick. They tell you you need it, but they don't want to give it to you. Okay, so healthcare reform, that was the biggest change probably in the nation's history as far as the insurance industry was concerned. Now it is guaranteed acceptance. You cannot be turned down. Okay? You also can't be rated up now. Yesterday's insurance, which is what I referred to before healthcare reform, you could actually be rated up if you had a condition. So let's take that high blood pressure again. Let's go over that. So you have, say, two 30-year-olds. One had high blood pressure, one didn't. Okay, the one that had high blood pressure, they could actually charge as much as they wanted to for that particular individual, and the other individual aside with no conditions at all, they could have a base rate. Okay, not really that much, not fair. So they took that out. So now you can't be charged more because you're sick. You're going to pay the same rate as someone in your geographical location and same age. Okay, that's how they do it. The only three things that actually set your rate now is your age. All right, so you see here I've got age bands. One of the things they used to do is they used to do what they call an 8-to-1 ratio. And what that did is that caused the older generation to pay premiums way up here, while the younger generation way down here. Okay? Excuse me. So when they closed that from an 8-to-1 to a 3-to-1, what that did is that leveled it out. Okay? So the older population premiums came down, while the younger population came up slightly. So it met in the middle somewhere. Okay? So it makes it more affordable for everybody. Okay? The second thing they can actually rate your policy for is smoking. Okay? So tobacco users will be charged 1.5 times higher than a non-tobacco user. Okay? But that is the only rate up moving forward that you can be charged extra for. The third thing that goes into your rates is your geographical location. Okay? And for those of you who might be familiar with Medicare, Medicare's been doing it that way for a long time, where they do it based on zip code. So 29666 and 29649, 29646 will all be grouped together, and those individuals will pay the same premium for that area. Okay? But that is the only three things that actually affect your rate moving forward.
Chris always forgets to mention this, and I'm sure it's because he's a man, but they can't charge you more for being a woman anymore either.
That is correct. Yeah, that's one of the things I do need to add on my slides.
Used to be women had to pay more for insurance across the board. We don't have to do that.
Yesterday's insurance, remember, that's what I referred to before the Affordable Care Act. Women actually had to pay higher premiums than men. Okay, now it's non-biased. Women pay the same premium price as a man does. Okay, again, these are the only three things that affect your rate. Carriers, also, one of the biggest problems within the industry, aside from turning you down when you needed it the most, was that a carrier could cancel your coverage. So let's say you had a bad year, all right? You got sick, or maybe you broke your leg, whatever the case was, and your claims all of a sudden went up. Keep in mind, you might have been paying on this policy for 10, 15 years. You have one bad year. On your anniversary date, what do? They drop it. Not anymore. Okay, regardless of your claims experience throughout the year, as long as you make your premium payments, they cannot drop your coverage. Okay? Again, that goes back to the insurance companies. When you needed them the most, unfortunately, they didn't want to be there for you. Okay, so that's one of the things that this put a stop to. Another big one was lifetime limits were eliminated. Most people didn't realize this, but most individual policies had $1 million lifetime limit on them. And what did that mean? That means if your claims ever hit $1 million, you were uninsurable. Okay? And if you guys remember, about 5 years ago, there was a young guy from Greenwood got hit in the head with a baseball. Trust me when I tell you, his claims went over $1 million. Keep in mind, he's 10 years old. So without this law being passed, he'd be uninsurable for the rest of his life because he's already met his lifetime limit. Okay? So what this law did was it eliminated that. So now he can go back and get coverage. Okay? So that's, while people think, $1 million worth of coverage, that's a big deal. We all know a trip to the ER doesn't take long to start racking up the zeros.
Amen.
Okay? One of the other things that the law did, and this is big for the Greenwood area, we have a lot of small business in our area. Okay? And for individuals who work for small businesses, it was expensive for that particular owner to create a group insurance policy. Okay, so one of the provisions in the law was to entice owners to offer group coverage to their employees and their families, was to offer them a tax credit in return for doing that. So what that's done is that a lot more business owners have started to offer group policies to help cover their employees. It's a win-win for everybody when you look at it. A healthy workforce is there every day. Productivity goes up, sales go up, it helps everybody. And of course, you know, we all care about our families, so if you can get the coverage that you need at work to cover your spouse, your children, it means a lot to them too. So to me, that was a big deal. All right, so you heard me mention, in order not to pay a penalty, you had to have minimum essential coverage. So what are types of this coverage that we're talking about? Minimum essential coverage is defined as coverage under certain government-sponsored programs, which include Medicare and Medicaid. So what does that mean? If you're on Medicare or Medicaid, you have coverage. You do not need to select a new plan. One of the biggest misconceptions is you don't listen to TV. Is changing Medicare. This is going to make all your Medicare beneficiaries, they're losing their coverage. They're going to have to pay more. Couldn't be further from the truth. Actually, and I don't get into specifics on the Medicare side, but healthcare reform actually had provisions in it where it helps to eliminate the donut hole. Is anybody familiar with the donut hole in prescription drugs? That's a big problem for a lot of seniors. I've done senior prescription drug plans and Medicare supplements for a long time, and one of the things you always have to tell them is, starting in January, you know, you'll have coverage through March, and then you're going to hit the donut hole. Okay? Well, there are provisions in healthcare reform to help eliminate the donut hole by 2021. So it completely goes away, which means you'll have that coverage all year instead of only partial coverage throughout the year. All right, so again, I want to stress this. If you have Medicare or you have Medicaid, regardless of what you hear on the TV, regardless of what anybody tells you, you are right where you need to be, and you need to do absolutely nothing. Okay, stay on that program. All right, so what about employer-sponsored plans? Now, a lot of people who say, my employer offers coverage, do I need to do anything? Most of the time, no. We'll get into specifics in a minute, but if you have employer-sponsored coverage, which means that you and your family can get coverage through your job, you do not need to do anything. All right, plans in the individual market. What does that mean? We've heard a lot about, can I keep my plan? Is my plan going away? There have been a lot of letters going out from the insurance companies talking about plans going away. It's been all over the TV. All right, well, they have changed a lot. A lot of the plans, let me start here. Plans purchased before March 23rd, 2010. So if you bought it before March 23rd, 2010, you have what they call a grandfather plan. If you like that plan and do not want to come off of it, you don't have to. Those are grandfathered in. You're good to go as long as you make your premiums. No need to do anything. All right, so what about those plans that were purchased after March 23rd, 2010? Those are what they call SE plans, okay? March 23rd, 2010, did anybody know what happened on that day? Okay, that's when the law was actually signed into effect, okay? The Affordable Care Act went into effect in March of 2010. So plans sold after that on the individual market were meant to get you from March until 2010 to January 2014. So they were designed to go away once the marketplace plans went into effect. So if you have one of those plans, I do urge you to consult with a professional to see if that plan is in fact going away or if you have coverage and it's going to stay. But if you have it, the plans before March of 2010, you have a grandfather plan, you are considered to have minimum essential coverage and will not be penalized. There are also other programs out there that is considered to be minimum essential coverage. That is any other health benefit coverage, such as a state high-risk health pool recognized by Health and Human Services. South Carolina's got one that's called SHIP. Okay, so if you're on SHIP, you can keep that plan, but realistically, it's probably cost-effective for you to go to one of the marketplace plans. Pre-existing condition health pool, if you know anybody on one of those. Okay, that was also gap coverage that come out of the Affordable Care Act, and that was for individuals who had pre-existing conditions that could not get coverage. those, you went on to that plan. So if you know anybody on PCIP, or they call it pre-existing condition plan, they were gonna lose coverage at the end of this year, it'd be 12/31 of this year. They need to look at getting other coverage. But those are some of the things you might run into or might have it yourself. All right, so we've talked a little bit about the individual mandate. Let's talk a little bit about the coverage itself, the levels of coverage. All right, so the marketplace, you've heard a lot about exchange, right? The exchange isn't working right, the computer system isn't working. One of the favorite parts of my job is to explain what an exchange is. All right, in its simplest form, it is a quoting system. It brings up every insurance company that is available and it lists it by price. That's all it is. So when you hear them talk about we can't get the exchange right or it's complicated, it's only complicated because they make it that way. In its simplest form, it's very simple. To operate, it's just a quoting system. But on the quoting system, on the exchange, there will be plans that are offered in a tier format. These 10 tiers are named after metals. You got the bronze, silver, gold, and platinum. Okay? Let's see. All right. So your platinum plans are your most expensive plans. They're actually like a 90-10 plan. Okay? So it's a co-insurance of 90-10. Okay? And co-insurance is exactly like it sounds. You're co-sharing in the cost of your health care with the insurance company. In a platinum plan, they're going to pay 90%, okay? And you're sharing in the cost, so you're going to pay 10. So it's a 90-10 plan, okay? However, not all carriers will be offering platinum plans. Most will have gold, silver, and bronze, okay? We know now that we've been involved in this for a couple months with it being operating, nobody's offering a platinum plan in our area, okay? So it's all gold, silver, and bronze. Platinum plans realistically probably would be cost effective for 99% of us anyway, not the way they do it. But we do have a gold plan. Gold plans are an 80-20 value. Again, they're paying 80% of your health care, you're sharing in the cost by paying 20. Okay? So again, what does that mean? Let's say you have a $100 hospital bill, they're going to pay 80 of it, you're going to pay 20 of it. Okay? And this is actually the silver, and I do apologize, the lights hit it just right. The silver plans are a 70-30 co-insurance, and then you have a bronze plan, which is a 60-40 co-insurance. Okay? Now the bronze plans will have the lowest monthly premiums, okay? But the cost share, which is your co-insurance, will be more. Okay, so just because you might pay a little less in a bronze, in the long run, may not be the plan for you. Okay, this depends on your health, really. Obviously, the higher the platinum and the golds will have the higher monthly premiums, but the cost shares are lower, so your true out-of-pocket may be a little different. Okay, one of the other things that the Affordable Care Act did, most importantly, was it includes a provision for essential health benefits. All plans moving forward, okay, must contain these essential health benefits as defined by the Health Care Reform Law. Specifically, the plans must include items and services from at least 10 categories. All right, so you got your ambulatory patient services. I'm gonna vote on it. Your emergency services, hospitalization, maternity and newborn, okay, which is actually really big. I don't know if some of you know or may not know, maternity coverage was actually not offered in individual policies for females. They had to be on a group, they had to work for somebody. So let's say you were a self-employed business owner, okay, and you had to go out and get your own health insurance as a female. You couldn't get maternity coverage, okay, on an individual policy. Now, all policies must include maternity and newborn coverage. And yes, gentlemen, that includes you. All your policies will have maternity coverage and newborn coverage, all right? Okay. Mental health services and substance abuse disorder services, including behavioral treatment. You know, realistically, as a nation, this is probably one of the most overlooked medical services that we do, because everybody typically turns a blind eye for individuals who may have substance abuse or some mental health issues. So a lot of policies didn't cover it. You know, if you needed to go get help for something and get back on the right track, you didn't have any coverage. If you couldn't financially afford to pay for it out of pocket, you were in serious trouble. Now, all policies must include these benefits. Prescription drugs. A lot of policies didn't beforehand did not include prescription drugs. Now, it's a part of every policy. The best part is there are policies actually on the marketplace or the exchange where your prescription drugs, when you go and buy your prescription drugs, it actually goes towards your deductible now and your out-of-pocket max. Used to, when you didn't have prescription drugs, you had to go to the pharmacy and pick up your prescription. That was just money lost. It didn't go towards your deductible, it didn't go towards your out-of-pocket max. That was just $20 you threw down the drain. That's pretty much it. Now it does include those and it goes towards that out-of-pocket. Rehabilitation services, okay, laboratory services, your blood work, things like that. Preventive and wellness, chronic disease management, okay? So what that means is all your preventative care now is covered at 100% with no copay. So they're really starting to promote wellness. They want you to go to the doctor. They want you to have that annual physical, all the necessary preventative tests, colonoscopies, things like that. Early detection is key. It's time for Christmas. We learned the earlier we catch something, the better off we are to treat it. So now you get those services at a zero copay. You don't have to meet any deductible. There's no copay or something like that. Pediatric services include oral and vision care. Okay. One of the big provisions, in my opinion, is taking care of the very young generation. Adults over the age of 19 don't have dental care and they don't have vision. But for our nation's children, all policies must include dental and vision. Okay. All right, so this is one of the hot button topics, which is the subsidy. Okay, how am I going to afford it? Who's going to help? And what's it really going to cost? All right, remember I talked about everybody agrees. Insurance companies jack up the prices and made it unaffordable for a lot of us. Okay, premiums, subsidies, and cost sharing. There's actually two different types of ways to get help with your insurance. The first one we're going to go over, of course, is the premium subsidy. The premium assistance subsidy reduces the amount that an individual or family pays for health insurance coverage by providing a tax credit. These subsidies are only available through the exchange. And then, like I said, the exchange is what you're hearing about on TV. That's the website they're having problems with. That's also referred to as the insurance marketplace. All right. It's also referred to as the insurance megaphone. It's basically where all your insurance companies line up trying to get your business. Okay. But you can only get your subsidy through an exchange. I'm going to stay on this for just a second because we've noticed a lot of agents or brokers, whatever you want to call them, that go out and try to sell off exchange programs. Okay. A lot of these programs are fine. The coverage is fine. But what you don't realize, or what family may not realize, is you may be missing out on your tax credits, which could dramatically reduce your subsidy. So it's important to understand when you go to buy your insurance, or have your family members buy your insurance, that you buy it through the marketplace. Okay, or you buy it through an enrollment center that has access, or an agency that has access to the marketplace and who is certified. Okay, and we'll talk more about that shortly. Subsidies are determined on a sliding scale based on your income. So the individuals on the lower end will get more help, while the individuals on the higher end of the scale don't get as much help. Okay? Okay, they're paid directly to the insured. Individuals are responsible for the remaining premiums. All right, so one of the biggest things we hear about too, obviously, is are they going to have to pay it? Am I going to have to pay the entire premium and then they're going to reimburse me? The answer is no. All right, so the example I like to give on this one is very simple. Let's say, for example, your insurance is $300 a month. You qualify for a 50% subsidy. That leaves you responsible for $150. So the federal government each month is going to pay $150 to the insurer of your choice, and you're going to be responsible for paying the other $150. Okay? So you don't have to come up with the entire premium up front and wait on anybody to reimburse you as far as the tax credit is concerned. That's called an advanced subsidy. It's delivered in advance so that people do not have to pay the entire premiums up front and wait for reimbursement. Okay? Now, the subsidy is based on the premium for the benchmark plan. That's the second lowest cost silver plan available on the exchange. And we talked about the silver plan. That's the 70-30 plan. Okay? So when they're doing their subsidies, they're basing it off of a silver plan. And I'll go ahead and say it on a few slides ahead. But it's important to understand that if you qualify for a premium subsidy, most likely you also qualify for the cost sharing subsidy. The only way to take advantage of that reduction is in a silver plan, okay, the benchmark plan. So if you choose the benchmark plan, you're going to get further help inside of your paying for your insurance. Each person applying for coverage will be required to pay 2% of their income at the lowest ends and 9.5% income on higher ends. Nothing gets under my skin more to hear somebody say, well, why do I have to pay for everybody else? Everybody's going to get it for free. I'm not going to get it for free. Okay? That's just not the case. Everybody that takes out an insurance policy will be required to pay. Now, if you're on the lower end of the scale, you'll only be required to pay 2% of your annual income. But no one is going to be required to pay more than 9.5% of their annual household income. Okay? And it's kind of hard to read, but here are the scales here. So up to 133% of the federal poverty level, all the way up to 400%. All right, so what does that really mean? Okay, to qualify for a subsidy, you must make at least $11,490 a year. Okay, and that's your annual gross. Okay, and if you're on the upper end, let me give you an example for the upper end. Let's say 400%. A family of 3. Okay, making $79,000 a year still qualifies for partial subsidy. Okay, so when you look at our demographic just here at Greenwood, I did the math one time, it's about 93-94% of all households in Greenwood, South Carolina, or Greenwood County will actually qualify for at least partial subsidy. Okay, so there's a lot of different ways to make the insurance affordable. To obtain a subsidy, an individual must be a citizen or national in the United States, lawfully present immigrant who files tax returns, and not eligible for any kind of other programs. And those programs include Medicare and Medicaid or affordable employer-sponsored coverage. Again, I can't stress enough, regardless of what the news says, if you're on Medicaid or Medicare, you're good to go. Don't touch it. Affordable employer-sponsored coverage. If you remember back just a slide, affordability is deemed to be no more than 9.5% of your household's annual income. Okay? So if your employer, if you work somewhere and the coverage they offer you is more than 9.5% of your annual salary, you can elect to come off of that coverage and go to an individual plan and get a subsidy. Okay? And that's what this slide is. Individual insurance through your employer can be subsidized, again, if it's more than 9.5% of your household income, or their plan is deemed inadequate. All right, so what does inadequate mean? The plan that's offered by an employer must be at least as good as a bronze plan. So it must cover the 10 essential benefits, and it also must meet the 60-40 co-insurance. Okay, so it must pay at least 60% of your health care costs while you're paying 40%. If those two things are not met, if one of those two things are not met, you have the ability to drop that employer coverage, go to the individual marketplace, and purchase your health insurance, and possibly qualify for a subsidy. All right, so we talked about the first subsidy, which is the premium subsidy, which helps reduce the cost each month of having insurance. So now let's talk a little bit about the cost sharing assistance. People who qualify for premium assistance tax credit will also be eligible for cost sharing assistance if they enroll in a silver plan. And that's why I stress how important it is for a silver plan. A lot of people who have talked to other individuals that I've come in contact with, well, they said I need to go to gold. They said I could just get a bronze and pay nothing, those types of things. please don't let nobody take you into a program that you don't need to be in. Okay, again, you need to see the bigger picture with the silvers and to see if you qualify for the cost sharing assistance. Because this assistance will further reduce the limit on your out-of-pocket maximum that can apply to your coverage. And it also can reduce your overall expenses each year. Okay? So to qualify for this cost sharing assistance, it depends, again, it's on a sliding scale of income. So individuals who are between 100% and 200% of the federal poverty level can reduce their overall limits by 2/3, while 201% through 300% of the federal poverty level, you'll be reduced by half, and 301 to 400% will be reduced by 1/3. Okay, what this really means is if you qualify for your premium subsidy, you get your cost sharing subsidy, you enroll in a silver plan. Let's say that silver plan for someone who doesn't have a subsidy, the deductible is $2,000. Okay, and you fall within that 200, 300% of the federal poverty level, that deductible can be reduced by half or up to half. So as much as $1,000 will come off that deductible. Okay, you've heard me talk a lot about out-of-pocket maximums. An out-of-pocket maximum is the most that you can be required to pay on your insurance, your medical costs, not your premiums, but the cost itself in any given year. One of the great things that the Affordable Care Act did was it set a limit on the out-of-pocket cost. For an individual policy now, that limit is $6,350. Okay, while it's still a lot of money, okay, that is the most. If you have $1 million bill, the most you're going to be required to come out of pocket for is that $6,350. And if you do that in January, okay, you have a very bad month, and that happens in January, February through December, all of your medical costs are covered at 100% with no more out-of-pocket cost. Okay, so put a cap financially on each household. Again, cost sharing assistance, if the individual chooses to enroll in a bronze or a gold, the individual will not be eligible for the cost sharing subsidy. No reductions will be in cost sharing available beyond the essential health benefits. Those 10 programs we talked about that must be included in your policy. That's where you get your reductions. There may be extra things that an insurer might put in, a Blue Cross or Blue Choice might put in something extra to the policy to get you to go with them versus somebody else. Okay, and if it's an extra outside of those 10 benefits, those 10 categories, cost sharing will not apply. Okay, to those. All right. Another great thing, the premium subsidy. Where we told you that was handled between the insurer and the federal government. Same thing with the cost sharing. The Health and Human Services Division of the government will notify the insurer that the enrollee is eligible for cost sharing. And so you won't have to do any extra paperwork or file any extra claim papers. All right, so this is one of my favorite parts. I used to hear it all the time. I just won't get coverage. What can they do to me? Okay, well, here's some things that they can do. In 2014, the annual penalty will be $95 per adult, $47.50 per child, up to a family maximum of $285, or 1% of the family's income, whichever is greater. Now, I always find it funny when I'm watching the news or somebody's talking about it, and they say, I'm just going to pay my $95 and I'm going to be done with it. I can't wait until 2015 when they pop it for 1% of the family's household income, because then they'll really understand that there was actually a penalty behind it. And the penalty actually gets more and more as we go on. 2015, it'll be raised to $325 per adult and $162.50 per child for a family maximum of $975 or 2% of the family household income, whichever is greater. 2016, it's $695, $347.50, $2,085 or 2.5%. That's as far as I went for the presentation purposes. I think everybody gets the fact that it's going to go up each year. So, and with every great law or every great rule, there's always the exception, right? So we'll go over what some of the exceptions are. Individuals with a religious exemption may be exempt from the law. Okay? I'm going to be honest with you. I'm going to tell you like I tell everybody. If you feel that you need to be exempt for your faith, you can log on to HHS, which is the Health and Human Services Division, and go over that list. Okay? The good news is, if you really don't like the law, I really don't think it benefits you. You always have the choice to get locked up, because if you're incarcerated, you don't have to worry about it. You just pay for all of it, you're done. All right?
Well, they
Individuals.
won't arrest you for not doing insurance.
Yeah, I do want to make that. That's actually a good time to chime that in. We were at a seminar a few weeks ago and had somebody get up and say, they're going to arrest me if I don't get coverage, right? Absolutely not. Okay, we'll go over some of the myths in a little while, some of the fun ones. But that was probably one of the best ones. Stood up dead serious. They're going to arrest me. Well, they're just going to have to take me to jail because I'm not going to do it. All right. Well, definitely won't have to worry about it if you go that route, but they're not coming for you. Undocumented aliens, individuals who cannot afford coverage. In other words, it exceeds the that's a typo, but it should be 9.5%. All right, so I'm going to take a moment to explain something. If you cannot truly afford coverage, even in the marketplace, even with a subsidy, we have seen it, you can file for what they call a hardship. Okay, if you file for a hardship and you actually qualify, you still won't have coverage, but you won't have to pay a penalty. One of the things that actually hurt the law in South Carolina was the fact that South Carolina elected not to expand Medicaid. Okay? What it was designed to do and what it was supposed to do was that, remember that $11,490 mark I told you about? That's what you have to make in order to qualify for a subsidy. Well, not everybody makes that. So when the federal government tried to get the states to expand Medicaid, it was supposed to cover the poor working adults who just didn't make that $11,490. They were supposed to be able to go into Medicaid. Of course, we all know the Supreme Court ruled that it was each state's decision as to whether or not they were going to expand it. Governor Haley decided South Carolina wasn't going to do it. Okay? So what that does is, unfortunately, it puts the lower income population at a disadvantage. If you don't make $11,490, you have to pay full price for your insurance or file for a hardship. Now, explain something. I'm still waiting for an explanation, but if you don't make $11,490 a year, how are you going to afford to pay full price? This is not going to happen. There are a lot of people fighting, including the hospitals. I'll let you know that the hospitals are on board. They're fighting the expansion. They're trying to get the expansion through. Unfortunately, it's not going to happen in 2014. We're hoping to see it in 2015 because the states that have elected to expand Medicaid have done extremely well compared to where South Carolina sits right now, because we're still going to wind up with, I think it's somewhere in the neighborhood of 12% of our state's population not covered with insurance because they truly can't afford it. And the way the law reads now, if you make more than around $600 a month, I think it is, you make too much money for Medicaid. So there's definitely a hole in there that we hope gets fixed moving forward. Okay? All right, so another exemption, individuals with gap of less than 3 months in coverage. Okay, what does that mean? All right, so if you go uninsured in 2014 for less than 3 months, okay, you won't be penalized. We've already talked about the hardship. Again, I encourage you, if you truly can't afford it, file your hardship paperwork and get that approved. Individuals below the tax filing threshold, again, that's $11,490. And members of Indian tribes. Okay, so what happens if you really do have to pay the penalty? The penalty will be paid as a federal tax liability on your income returns and enforced by the treasurer. Individuals who fail to pay the penalty will not be subject to criminal penalties, liens, or levies. It's not a criminal offense, but if you enjoy a tax return, you better pay your penalty or get insurance, because they're going to take it. Okay? I don't know about y'all, but I look forward to February and March every year. As long as I wind up not having to pay. See, that's been a problem lately. So, all right, so we used to do top 5 questions that we've got, but we've gotten to where, especially a group this size, I'll open the floor up. I won't go over the most common questions, but I would be happy to answer any questions that you guys have at this point.